Surgery for a torn labrum in the shoulder is needed in some cases. In this video, I'll explain to you the 3 most common types of surgery done to do a repair for the labrum in the shoulder. Just to bring you up to speed, the labrum in the shoulder is a piece of cartilage that surrounds the socket side of the joint. It's a ball and socket joint in the shoulder, but because the socket is so small, the labrum deepens the socket to give it more contact for better stability in the joint. And the reason why it's cartilage is because it makes the edges of the socket flexible. Since our shoulders are so much more flexible than our other ball and socket joint, the hips, that one does have a deeper bony socket. The labrum will tear in some cases with repetitive forces, but really it's a root problem of a muscle imbalance that pulls the ball off the socket and the mechanics are off and it starts to rub the edges of the labrum inappropriately, or you start to use your bicep muscle in an inappropriate way and that starts to pull the labrum off the edge of the bone here. Now, the first surgery that's done is a debridement surgery, and that's where the surgeon will go in and clean up the edges of the labrum that are not worth repairing. They'll cut them off and smooth it out so that you can have better mechanics or better movement inside the joint. The second surgery is a biceps tenodesis surgery. Now, this is referring to the bicep muscle in front of the upper part of the bone here because it sends one of its tendons right through the groove of the humerus or this upper arm bone right over here, and it attaches to the top part of the socket directly to the labrum. And if you're using that bicep inappropriately and you have a muscle imbalance going on in your shoulder, it can yank at that attachment and pull the edge of the labrum off the bone, off the socket side of the bone. So what they'll do in a tenodesis is they'll reattach that tendon from its original attachment at the top of the socket to somewhere on the upper arm bone so that it is no longer pulling on the labrum. And then the third surgery that's done is a labral repair surgery. So the edge of the labrum here is coming off the edge of the socket. So what they'll go in and do is suture or tie it down essentially. They'll usually use some little tiny anchors or little metal screws that they'll put in that will hold down the surgical thread, the sutures, so that it can hold the edge of the labrum down against the bone and put it in a position where it will reattach to the bone the way that it's supposed to be. Now, it is not uncommon to have all 3 of these procedures done in one single surgery. The surgeon might go in and debride edges of the labrum. They might also do that biceps tenodesis surgery, and then they'll also put the sutures in to tie down the edge of the labrum, all in the same procedure, or you might have some combination of those procedures done in a single surgery. This is all typically done through arthroscopic tools, meaning they just poke holes where they put in tubes where they can insert different tools in a camera to be able to see inside the joint, rather than an open surgery where they cut everything open and they can visualize or see everything. That's a lot more invasive than just the arthroscopes. Now, you need to know that surgery can be avoided in most cases. It is necessary in some cases, but very often there's a root muscle imbalance that just needs to be addressed, and that can help to position the ball on the socket better and improve the mechanics at the joint so that it's not pushing on the labrum inappropriately, and you can naturally heal that labrum so that it heals against the bone. It reattaches, and then if you can maintain your strength in the proper balance for the long term, then you should be able to keep your shoulder healthy for the long term and avoid surgery. Hey, if this video was helpful for you, please give us a thumbs up. Please consider subscribing and turn on our notification bell so that you don't miss out on any of our future videos. Also, check out the link in the description below to get more videos for shoulder labrum problems. I'll see you in the next video. Bye-bye.